Today, we'll be discussing some oral and systemic treatments for hidradenitis suppurativa, also known as HS. As always, this is for informational purposes only. This should not be used for medical advice. Thank you. Welcome back, everyone. Today, I want to talk about hidradenitis suppurativa, also known as HS or acne inversa. I particularly want to focus on oral and systemic medications today. So this is my website. You can come here and find all the resources and the links. Oral medications play a crucial role in managing HS. These medications work systemically, targeting inflammation and hopefully the underlying disease process. Here's a little diagram showing the various oral regimens as it relates to their category: oral antibiotics, hormonal therapy, retinoids, pain relievers, and metformin. Oftentimes, we give oral antibiotics for HS. It's not because HS is a bacterial infection, but it's because these antibiotics have additional properties that reduce inflammation, leading to reduced severity and flare-ups. There are some combination therapies in the literature, such as clindamycin and rifampin, that have shown to be particularly effective in patients. Long-term low-dose antibiotic use can also be considered in some patients to maintain the disease control, but there are always concerns about long-term antibiotic use and resistance. So we always have to have a nice discussion regarding the risks and benefits. Hormonal therapy. This is particularly for women with HS. We do think that hormones likely play a role in HS, so treatments with oral contraceptives or spironolactone can sometimes help patients with HS, reducing the severity and the flares. Oral retinoids, like Isotretinoin or Accutane and Acitretin. There are vitamin A derivatives that can reduce inflammation and normalize epithelial cell function. They're not first line for HS, but they can be helpful in some patients, particularly those with other inflammatory lesions that are reminiscent of acne, whether it's on the face, the back, the chest, the scalp. These retinoids can be efficacious, although they don't work for everybody. Pain relief is very important for patients with HS. We'll talk about this more in another video, but patients with HS, one of the worst things about it, the reason it impacts their quality of life so much, is because of the pain. And so having a good pain regimen, knowing what to take and when to take it, can be helpful. There are some studies that show that patients with HS flares are more likely to go to the emergency room, seek stronger medications such as opiates, which can be helpful in the short term, but in the long term can lead to recurrent ER visits and really no long-term effective management of the HS. Really, it's important to have a pain plan for flares, but it's also important to have longitudinal follow-up with a board-certified physician, a dermatologist, to address the underlying inflammation and hopefully reduce long-term pain and suffering. So metformin, almost a universal medication for type 2 diabetes, it has been shown in some studies to improve HS. Now, I didn't put it here because it's technically not an oral medication, at least not yet, but GLP-1s like semaglutide, Ozempic, Wegovy will likely play a role in HS management in the future, showing improvement in conditions like psoriasis. So I will not be surprised when patients that are being put on semaglutide for their diabetes or their weight loss will also show to have significant improvement in their HS. So speaking of more recent treatment advancements in HS, we think about immunotherapy or biologic therapy. Humira, or adalimumab, is a medication used for many conditions: rheumatoid arthritis, psoriasis, and now hidradenitis. It was the first biologic approved for hidradenitis, and it still continues to help many patients reduce flares, reduce disease burden, and reduce recurrence. Remicade, or infliximab, is another TNF-alpha inhibitor given intravenously that can be titrated up to higher concentrations to help patients with recalcitrant, pretty severe HS. There are two new medications approved just within the last year and a half for HS. Those are Cosentyx, which is an IL-17A inhibitor, and Bimzelx, which is a 17A, 17F inhibitor. Bimzelx was just recently approved as of late 2024. These two medications are more targeted than the adalimumab or the infliximab, and as such, often thought to have a safer profile. The advancement of biologics is reassuring because a decade ago, we really didn't have much for HS. So now it's great that we have these 4 medications and likely more on the way that will help treat this very frustrating condition. So, to conclude, HS is stubborn and challenging. There are many oral medications. There are some biologic medications now. We will discuss surgical therapies and laser therapies because those are important, and often patients need a multimodal approach to navigate the HS and to lead to the best overall outcome. Thank you for watching to this point. If you thought this was helpful, please like it. Share it with someone that you think might benefit from this information. I'd like to get this information out to as many people as possible. If you have any questions, please let me know. And as always, thank you so much.